It isn't polite to call them ghettos anymore, but every city in America has at least one. A neighborhood where the poor and working poor struggle to survive. Northeast Portland, Oregon is one such neighborhood. Life here is like most anywhere. People go to work, raise families, send their kids to school, all with limited resources. But they also do it all with faith. Pastor Mary Overstreet Smith of Powerhouse Temple Church ministers to her Northeast Portland congregation every Sunday. While the life of the Spirit comes first, the physical needs of her flock are important too. When the devastating aftermath of Hurricane Katrina became apparent, Pastor Mary listened to the voice within that told her that people couldn't wait for help. She decided to send a van for those willing to make a fresh start in Portland, and eventually relocated, clothed, fed, and housed 40 families. When some of the survivors needed medical care and medications, she also discovered that many longtime community residents in Northeast Portland had no health coverage, even those who worked full-time. That's when she met Dr. Jill Ginsburg, a physician for Kaiser Permanente, when the doctor was dropping off donations for the hurricane survivors.
I mean, we really didn't even have a chance to introduce ourselves, and she said to me, you know, what we really need in this neighborhood is a free medical clinic.
And she said, well, okay, well, we'll see. We'll see. I'll get back to you and we'll see.
I could see the need, and I said, you know, I think that's a great idea. And, you know, when you get it going, let me know. Maybe I can help you out.
What is there to think about, you know? You're here, you're a doctor, you're what we need. I said, we really need a clinic, in this area for the people.
She pretty much literally took me by the arm. We walked a block and a half up the street to this building where she had an office, and they had been using it as a bakery.
It's just like it dawned on me. She's here, I'm here, she's predestined to be here.
I figured it couldn't be that hard. I had a medical license, and we had some space, and had a stethoscope and a prescription pad, and I thought maybe I could, you know, help some people. So
she was just an angel in disguise. She just didn't have the wings growing out of her back.
And so the North by Northeast Community Health Center was born in August of 2006. And while it has proven far more challenging than co-founder and clinic medical director Dr. Ginsburg could ever have imagined, it has had a profound effect on the neighborhood.
Well, I think the thing that I have noticed the most is how many of the people that we see here are hardworking people who are between jobs or who've lost their insurance because they're ill. I think people often think, well, I'm employed, I'm doing all right. But in fact, I think the tragedy of the American health system is that if you become ill enough to lose your job, you'll lose your health insurance.
One such patient is Jesse Kane, who discovered when he came to the clinic that he had diabetes.
They really saved my life, because I've learned since I've gone there, and I read pamphlets, I've been studying on the internet about diabetes, the effects of diabetes, from blindness to amputations. And if I didn't go there, if it wasn't available, I can honestly say, I don't know what would have happened.
Volunteer staff and medical providers welcome patients on Thursdays from 6 to 8:30 p.m., offering free health care and medications to neighborhood residents in need. The clinic is also open at least 2 Mondays a month for follow-up appointments, and has a goal of opening every Monday when they have enough volunteer physicians. It's only a beginning, and it's the help the clinic has received from area hospitals, the gifts of donors, the dedication Jill Ginsburg and the rest of the volunteer staff, and Pastor Mary's unwavering faith that have kept the clinic going so far.
The Lord provided. The Lord blessed us and carried us through. And because God was in it, God brought it to pass. Clinic was open in 9 months when they said we couldn't do it.
Our primary need is more physician volunteers, because with more physicians we can expand our hours and take care of more people. And we also always need financial support.
Right now this place is small, it's compact, it's crowded, but I think they do a tremendous job in seeing the people that come with no appointment.
There are many ways you can support the clinic. All donations are tax deductible. North by Northeast Community Health Center is a volunteer-run organization, and financial contributions go a long way too. A $20 donation purchases a 3-month supply of medication for an individual with hypertension or diabetes. We need your support for people in desperate need of medical attention. For more information about how you can help, please call or visit our website.